Welcome everyone to today's presentation on the Federal Oversight of Health Information Technology, or HIT, and mobile medical apps. My name is Rebecca Gwilt, and today I'm going to take you through the two primary pieces of federal guidance released in the last year that form the foundation of the current thinking on the regulation of emerging health IT and mobile medical innovation. This is an evolving area of law, so I caution you not to expect that you will have an indisputable right answer to all of your questions at the close of this presentation, but you should begin to understand the perspective of the regulating agencies, which is a good start when you begin to evaluate the design or adoption of health IT. Beyond discussing the content of these pieces of guidance, I'm going to talk a little bit about what isn't included, and I'll provide some of my own musings on what we can expect looking forward. This presentation is being recorded and will be available to you after the meeting at www.healthcaresolutionsconnection.com, and we'll give you that website again at the end. And we will also try to email the attendees a link to the presentation. Before we jump right in, I'd like to give you a little bit more background about me. I'm an attorney at the Nixon Law Group and a principal at Redbird Law and Consulting, LLC. I started my career at the Centers for Medicare and Medicaid Services, where I focused on Affordable Care Act reforms, technology, and privacy and security issues. I continue to focus on these issues in my current practice, and I'm also a member of Healthcare Solutions Connection, which is a national network of healthcare consultants serving providers, insurers, developers, and vendors in the healthcare industry. My colleagues and I share a commitment to helping healthcare entities adjust to the rapidly changing healthcare landscape we face today, both from a legal and operational perspective. So now the introductions are out of the way. We are seeing just such an explosion of health IT today, and many of the new companies we work with at Healthcare Solutions Connection are struggling with the desire to lead the pack, and then also the fear of violating the somewhat slower-moving federal regulatory rules. The purpose of today's presentation is to try to illuminate the federal regulatory perspective and to help you all understand how to apply the proposed framework to your projects or clients so that you can move forward, innovate, create, and change the face of healthcare. As a general rule, I think what this guidance tells us is that the federal government shares that desire, and that's a good thing for all of us. We're going to start the presentation with a few details about the health IT and mobile health markets. The bulk of the presentation will be a deep dive into the most recent health IT report from the Office of the National Coordinator for Health IT, the Food and Drug Agency, and the Federal Communications Corporation, and the roles that all of those agencies play. Then I am going to provide a brief overview of last fall's mobile medical apps guidance, and we'll conclude with some criticisms and some predictions. Please note this is a listen-only meeting, but I will be monitoring the chat box for questions. If you have a question at any time during the presentation, please enter it in the chat box at the bottom left side of your screen. My colleague, Carrie Nixon, is on and will be responding to you there, and I will respond as I can. At the close of the presentation, I'm going to stay on and answer additional questions you send in, so you can use the chat box at the end of the presentation as well. As I mentioned before, the health IT and mobile health markets are growing exponentially. The global health IT market is projected to grow to $66 billion by 2020, and according to a report published by Deloitte in 2012, the U.S. is leading the world in the adoption of health IT. And this is really spurred on by a lot of the recent federal healthcare reforms, including the EHR incentive program, the meaningful use guidelines, and these actually predated the Affordable Care Act. There's even more in that piece of legislation. Providers of all sizes that choose not to adopt health IT at minimum electronic health records are going to start to see major penalties up to a 6% reduction in federal reimbursement. As of 2013, more than half of all doctors and other eligible providers have received Medicare or Medicaid incentive payments, which means they had to have electronic health records for adopting or meaningfully using those health records. That's more than double the rate in 2012. And the percent of physicians using an advanced EHR system was just 17% in 2008. Today, more than 50% of eligible professionals have demonstrated meaningful use and received incentive payments. So that's just a huge amount of growth. For hospitals, just for comparison, 9% had adopted EHRs in 2008 today, and in 2008, but today more than 80% have. The mobile health market is booming as well. The number of mHealth apps on the two major operating systems, the iOS and the Android systems, more than doubled in the last 2.5 years. There are now more than 100,000 of them, with more being created every day. Market revenue for mHealth apps was $2.4 billion in 2013 and is projected to grow to $26 billion by the end of 2017. So that's just huge. They're just astronomical numbers. And because of the potential impact on consumers and the speed at which this industry is moving, the federal government is driving major efforts to get their hands around how they can both protect the interests of the public and not get in the way of something that's really boosting our economy at the same time. Before we jump into how they plan to do that, it may be helpful to define what I mean when I say health IT. And mobile medical apps that I mentioned in the last slide are sort of a subset of health IT. There isn't a strict legal or statutory definition, and the concept really morphs and changes as new technologies emerge. But in general, health IT includes software, hardware, and infrastructure designed to collect, store, and exchange patient data through the clinical practice of medicine. These are things like electronic health records, patient management systems, and e-prescribing. Those are sort of the ones that are most familiar to people. What this definition fails to address is the use of that information for diagnosis, analysis, etc. The HHS Office of the National Coordinator, or ONC, recently defined health IT as the application of information processing involving both computer hardware and software that deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge for communication and decision-making. You'll notice that the difference there is they talk about the use, but we're still speaking in sort of older language in terms of hardware and software. Even expanded, there are those in the tech community that really think that these definitions fail to capture the totality of the world of health IT. There's actually a website called Healthcare Information Technology Directory, and it's a desktop search tool used by healthcare entities to find appropriate technologies for whatever it is they're looking for. There are 30 categories of products on that website, and some categories have more than 15 subcategories. To give you an idea of the breadth here, these are cardiology patient ID systems, surgical decision support systems, 3D visualization and analysis applications, case mix management systems, coding systems, health and well-being applications, health information exchange systems, remote patient monitoring, digital radiology, mammography, angiography, and so many more. Mobile health applications, like I said, are a subset of health IT. So if you add in all of the apps being created for health and fitness and diet management, et cetera, you have an even larger net to cast. So the question is, how does the federal government intend to regulate an industry that it has trouble even defining the scope of? And that's when you enter the FDASIA report. Many people call it the FDASIA report. There is no right way to say it. Section 618 of the Food and Drug Administration Safety and Innovation Act, or FDASIA, mandated that FDA, that's the Food and Drug Administration, HHS, Health and Human Services, and FCC, Federal Communications Corporation, adopt a report proposing a strategy and recommendations for a risk-based health IT regulatory framework. The purpose of the FDASIA provision requiring this report was to develop a process that avoids the duplicative regulation that potentially could emerge from FDA, ONC, and FCC for health IT stakeholders. And those include vendors and developers as well as consumers. And the hope is that that'll encourage innovation and investment in health IT. FDASIA authors drew on prior work and guidance from the Institute of Medicine, ONC, FDA, and FCC, including the mobile health app guidance we'll discuss a bit later, and recommendations from the FDASIA working group, which included private industry stakeholders as well. The report was published on April 7th and had a comment period, a 3-month comment period that ended July 7th. This report provides a really important insight into the proposed regulatory approach that will affect software developers, other manufacturers and vendors of health IT systems, and healthcare providers that purchase and implement these systems. At a high level, the report reflects an agreement by the 3 agencies to settle on a regulatory framework that emphasizes the use of voluntary standards, voluntary being a really important piece here, best practices and industry testing to mitigate patient safety risks for the majority of health IT products. The report lays out a limited, narrowly tailored approach that primarily relies on ONC coordinated activities and private sector capabilities. Most importantly, the report does not advocate for any additional areas of FDA oversight. Those are sort of the big guns that cause the most anxiety, the most cost. The goal of the framework is to create a nationwide health information technology infrastructure that encourages the creation of health IT that can prevent medical errors, improve efficiency and healthcare quality, reduce costs, and increase in consumer engagement. And those are themes that you see running through a lot of the recent health reform legislation in the last 10 years. So the FDASIA report actually defined health IT even more broadly than it has been defined in the past. The definition includes a wide range of products, technologies, and services designed for use by healthcare entities, healthcare providers, and consumers to electronically maintain access and exchange health information. I can't think of really anything health-related and not paper-based that isn't included here. Basically, anything that uses electronic means, contains health-related information, and is designed for use by anyone is included here. This sounds like it could lead to major overreach, I know. However, keep in mind that the framework is risk-based, meaning that for those pieces of health IT that in the government's estimation do not pose a risk to consumers, it's unlikely that they'll be subject to broad oversight. So I want to point out here, before we move on, that the risk-based approach gets a little complicated when you're looking at health IT because products can have multiple components. The FDASIA report makes clear that it's going to focus its attention on each piece of functionality and not on the specific platform used or the product's name or the product's description. For example, imagine a product that enables remote patient monitoring, which is a category of health IT, such as a blood glucose monitor. This product transmits information directly from the monitor to the doctor's office. In addition, the product is linked to an app that helps the patient track his or her own patient-generated health data, including diet, feelings of health or illness, and medication adherence. It also displays information on a person's smartphone that it got from that monitor. The company calls this an at-home diabetes wellness kit, but what the government is really going to look at is each piece of functionality. When deciding how to analyze the product under the risk-based framework, you would need to examine the costs, the app, and the two different functionalities that the app has, so directly displaying the results of the blood glucose test and also the tracking of the sort of patient-generated health data. The data transmission functionality, if this is transferred over the over broadband, then the FCC might be interested. So it's probable that each piece of functionality would require a different level of control. I'll come back to this example a little bit later, but I just want to point out that the agencies purport to look at health IT at all stages during the product life cycle. So this isn't just for people designing apps. This is a regulatory framework that's going to apply to the implementation of health IT and to the post-deployment maintenance and upgrades. So wherever you are in the process, you want to be examining what the risks are. And not just for the technology itself, but for the people who interact with it, the processes in which it operates, and the external environment. So getting to the framework itself, the report identifies 3 categories of health IT: administrative health IT functions, health management health IT functions, and medical device health IT functions. Administrative health IT functionality includes things like inventory management systems and appointment scheduling systems. They assist healthcare entities in completing their administrative duties. The report states that because these health IT products pose a really limited or no risk to patient safety, there's no additional oversight necessary. But keep in mind, these systems do still need to abide by current law, such as HIPAA, privacy and security standards. Health management health IT functionality includes encounter data, documentation, clinical decision support, medication management, patient identification functionality. These are functionalities that pose somewhat higher risks for the types of health for consumers, because they can directly impact care given to patients. However, health management requires direct evaluation by clinicians before care is administered. So, for instance, for clinical decision support, the doctor's still making the final decision, but a health IT application or piece of software is sort of helping guide them. That really minimizes the potential risks. In addition, there are major benefits to the use of this type of health management IT. For this reason, the report states that even if these types of health IT meet the definition of a medical device, which we know medical devices are regulated by FDA, that the FDA will not focus its regulatory oversight on them. Instead, it would be governed by the proposed risk-based framework in the FDASIA report. The FDA does plan to continue to focus oversight on medical device health IT functionality. This category includes things like robotic surgical planning and computer-aided detection or diagnostic software. These items are considered to pose the highest risk to patient safety, as in many cases they directly impact patient care, and they will be monitored most closely. However, FDA will share oversight with ONC and the FCC for devices that contain multiple functionalities. As I mentioned before, the FCC may be concerned with the use of wireless spectrum for wireless medical devices. If the medical device is considered health management, health IT, it may fall under the risk-based framework. It really depends on sort of the different categories of functionality. The report's primarily focused, therefore, on health management, health IT functionality. The agencies proposed a framework with the following key principles: a risk-based approach to appropriately mitigate patient safety risks while avoiding unnecessary regulatory oversight, leveraging the private sector, facilitating innovation, promoting transparency of product performance and safety, and creating an environment in which the industry itself continues to learn and improve. Note this is a voluntary framework currently, and therefore one that doesn't use regulation as the basis of its approach. This should encourage a collective sigh of relief from the health IT community, and while this framework will grow and change in its details, its underlying assertion is to use voluntary standards based on federal guidance rather than more inflexible regulatory rules and associated penalties. The report identifies four what they call key priority areas to form the basis of the framework. The first is promoting the use of quality management principles, including a quality systems approach. The agencies plan to work with health IT stakeholders to hash out what the quality framework should look like and how it should be applied. That is not addressed by the report. The second is to identify, develop, and adopt health IT standards and best practices. There are multiple national and international standards existing today that are relevant to health IT, and ONC plans to focus on adoption and implementation of those standards, which is sort of an extension of the work that they already do. And they're specifically looking at interoperability, quality and risk management, health IT design and development, local implementation, which basically means the introduction of the health IT into the local hospital environment, so sort of moving it into the existing processes, customization and maintenance of health IT as well. The third is to leverage conformity assessment tools such as product testing, certification, and accreditation. And the fourth is to create an environment of learning and continual improvement. The report lays out options for both mandatory and voluntary reporting of adverse events and near misses, and using that information to analyze and identify patterns and trends and promote system-wide education. This is one of the areas that sort of causes some heartburn, but again, the underlying theme is that they want to base this on a voluntary framework and not move to sort of mandatory reporting. The last piece, which isn't described as one of their four key priority areas, is that they plan to establish a health IT safety center. There have been a host of reactions in industry to the concept of this center, and we'll talk a little bit more about that later, but the report reflects a desire that the center would be made up of both public and private stakeholders, and it would be tasked with sort of cementing the health IT framework and promoting that continual improvement. I want to touch here on what the report says about which agencies are doing what here. There's sort of a lot of them. This is a tri-agency report, meaning it was created in collaboration between three agencies, each agency agreeing to the content and direction of the report. The agencies will continue to collaborate on the framework, but each agency does have a different role. The FCC is mostly concerned with broadband and spectrum issues, which are relevant but less controversial for the purposes of today's presentation. So ONC, again, the Office of the National Coordinator for Health IT, which is inside the Department of Health and Human Services, and the Food and Drug Administration are the two primary players. Currently, it is ONC's role to adopt standards and certification criteria for health IT, perform certifications, and administer programs to promote electronic exchange of information. They are administering a lot of the EHR and meaningful use initiatives. And FDA, again, regulates medical devices. So they assure the safety and effectiveness of medical devices and expedite patient access. The proposed role for FDA in the FDASIA report is that they will not focus oversight efforts on health management, health IT, but they would continue to oversee medical devices. I'm certain you can see the tricky area in here. There are no real clear lines regarding what is health management, health IT, and so some companies may be left in a gray area, potentially subject to medical device regulation and potentially subject to the voluntary risk-based framework. The proposed role for ONC is to, again, play a leadership role in developing standards for and applying the voluntary risk-based framework. Many stakeholders, especially consumer protection groups, have lauded the framework and applauded the agencies for including a large range of stakeholders in the process and incorporating many of the working group recommendations in the final report. But as a product meant to, the product being the report, as a report meant to satisfy a broad audience and gain wide consensus, it lacks some specificity that could have helped the industry gain more confidence moving forward. I'm going to go through a couple of my reactions to the framework, and then I'll touch a little bit on what we've seen from the public comment process. The report gives the agencies broad enforcement discretion to really determine on a case-by-case basis what will be regulated and when, rather than setting clear limits. It provides examples of which bucket existing technologies may fall into, but it doesn't provide a bright line standard or guide for determining which bucket unlisted technologies fall into. And, when I say listed, it's a list of 10 out of, 100,000 or more. So while it tries to describe what it means, there really aren't any bright line standards. And while that was meant to encourage sort of flexibility, it does leave many questions unanswered, which does tend to stifle innovation or at least slow it down. The report also does not state when substantive guidance or oversight guidelines will emerge, also leaving stakeholders without information needed to move forward and plan for new products. Even though explicitly requested in the report from the working group, the report failed to provide clear guidance regarding whether clinical decision support functionality would be regulated by the FDA. There is conflicting guidance in the report, and also conflicting guidance with the mobile health guidance that came out last fall regarding clinical decision support, and it's sort of a big area that they keep failing to address. The American Hospital Association blatantly opposes the framework and instead supports existing safety reporting requirements and initiatives. So they really just want to bulk up the existing framework for reporting patient safety issues. The HIMSS, Electronic Health Record Association, requested more clear and detailed risk category definitions, which is not surprising. That organization represents 40 EHR vendors. And again, a couple of other industry folks criticized the report for the lack of detail regarding clinical decision support. And my last criticism was that the report failed to clarify how specific aspects of FDA medical device regulation apply to health IT. And that includes things like medical device accessories, medical device software modules, and mobile medical apps. So I wanted to be able to touch on the mHealth guidance that came out last fall. Mobile medical apps, as I mentioned earlier, are a pretty fast-moving segment of the health IT market. Last fall, the FDA released guidance on mobile medical apps and created its own regulatory framework. Like the FDASIA framework, the FDA's guidance employs a risk-based approach focusing on application functionality, not platform, in order to determine whether or not to regulate mobile medical apps or which mobile medical apps to regulate. Mobile medical apps that do not meet the definition of a medical device remain unregulated, and that's in the same spirit as the FDASIA report. But for those mobile medical apps that meet or may meet the definition of a medical device, FDA plans to either regulate or exercise enforcement discretion, meaning they could choose not to impose the requirements that apply to medical devices generally. A mobile medical app is, there are a couple of different names, but for the purposes of this guidance, the mobile medical app means it's a mobile app that meets the definition of a medical device, and either is intended to be used as an accessory to a regulated medical device, or to transform a mobile platform into a regulated medical device. FDA regulates medical devices, so the trick then is deciding whether your app is considered a medical device. Section 201H of the Federal Food, Drug, and Cosmetic Act defines a medical device as pretty broadly as an instrument, apparatus, implement, machine, contrivance, implant, in vitro reagent, or other similar or related article, including any component, part, or accessory, which is either 1, intended for use in the diagnosis of disease or other conditions, or in the cure, mitigation, treatment, or prevention of disease, or 2, intended to affect the structure or any function of the body. And that's generally talking about pharmaceuticals. Therefore, the intended use of a mobile app determines whether it meets the definition of a device. To determine intended use, the agency is going to look at the whole picture: the product, the internal and external description of the product, meaning marketing materials, both public-facing and within the company used in the planning process, its design features, and its medical and non-medical uses, and to try to determine which one takes precedence. The next trick is to determine whether, so if it's not a medical, doesn't meet the definition of a medical device, it wasn't regulated before, it's not regulated now, it's the same. But if it does meet the definition of a medical device, or arguably does, the next trick is to determine whether FDA plans to apply its regulatory authority or whether it's going to use that enforcement discretion. So the guidance states that FDA plans to focus its oversight only on those mobile apps that meet the statutory definition of a device and are either intended to be used as an accessory to a regulated medical device or to transform a mobile platform into a regulated medical device. The FDA believes that this subset of mobile medical apps poses the same or similar potential risks to the public health as currently regulated devices if they fail to function as intended. This includes mobile apps that are an accessory to a medical device by connecting to a device to control the device or display, store, analyze, or transmit patient-specific medical device data. So to go back to my earlier example for the blood glucose monitor, if the information transmitted from the monitor shows up on the patient's phone as a mobile app, then you're in the area of mobile medical apps because it displays, stores, and transmits patient-specific medical device data. That blood glucose monitor is itself a medical device by the strict definition, but because that app displays, stores, or transmits data that it pulled from that medical device, it drops into the category of mobile medical apps. This category also includes functionalities similar to currently regulated medical devices using special medical attachments, generic attachments, or no attachments. For example, a mobile app that uses a mobile platform for medical device functions, such as the attachment of a blood glucose strip to a mobile platform to function as a glucose meter. So, for instance, if you were able to plug something into your iPhone that made your iPhone serve as a blood glucose monitor, so instead of having a separate monitor, you have an accessory that plugs into the phone that you put a drip of your blood on, and the phone reads it as if it was a glucose monitor. That mobile medical app is a regulated mobile medical app and would be determined to be a medical device. The last category is clinical decision support. Again, this causes a lot of confusion. In some cases, it's health management, health IT. In some cases, it's regulated mobile medical app. These are apps that provide patient-specific analysis, diagnosis, or treatment recommendations. The next category are the unregulated mobile medical apps. These are things like e-textbooks, business operations IT, which is similar to the administrative health IT as described in the FDASIA report, educational tools, that kind of thing. The third category are the mobile apps that are subject to enforcement discretion. FDA intends to exercise enforcement discretion when it comes to some mobile medical apps that may meet the definition of medical device, but that pose a low risk to patients. FDA intends to exercise enforcement discretion for mobile apps that help patients self-manage their disease without providing specific treatment or treatment suggestions, provide patients with simple tools to organize and track their health information, provide easy access to information related to patients' health conditions or treatment, help patients document, show, or communicate potential medical conditions to healthcare providers, automate simple tasks for healthcare providers, or enable patients or providers to interact with the personal health record or electronic health record system. For example, these include mobile apps that provide or facilitate supplemental clinical care by coaching to help patients manage their health in their daily environment, mobile apps that provide patients with simple tools to organize and track their health information. These are things like MyFitnessPal and MapMyRun. Mobile apps that provide easy access to information related to patients' health conditions or treatments, like apps that use a patient's diagnosis to provide a clinician with best practice treatment guidelines for common illnesses. Mobile apps, it includes mobile apps that are specifically marketed to help patients document, show, or communicate to providers potential medical conditions, and mobile apps that perform simple calculations routinely used in clinical practice, like body mass index and APGAR scores. Just keep in mind that the FDASIA report says even if FDA has the authority to regulate because a piece of health IT is a medical device, the agency does not plan to focus its regulatory oversight energy on those devices that are categorized as health management, health IT. So looking forward, the agencies are currently reviewing and responding to comments that came in during the 3-month comment period ending July 7th. The plan was to further hash out the framework based on those comments and most likely release further guidance. I should mention that just this week, the House Energy and Commerce Committee questioned the ONC's authority to even create the Health IT Safety Center and to perform the other tasks under the Health IT framework. ONC has responded that it does have the authority to carry out the framework, but clarified that it is not regulatory in the traditional sense. It is not a codified bright line rule that has associated penalties. All signs currently point to the committee continuing to pursue the matter. This is likely to slow down the agency's work, but it won't stop their efforts. Some members of the Energy and Commerce Committee are in favor of completely deregulating the industry. Representative Marsha Blackburn introduced the Software Act last fall. It's the longest acronym I've ever seen. I won't go through it. This legislation would establish 3 categories of software: clinical, health, and medical, with the 2 former software types not subject to any regulation at all. The PROTECT Act was introduced in February as a companion to the Software Act. It was introduced in the Senate. And that act would remove FDA regulation from even high-risk clinical decision support software, mobile medical apps, and other medical device functionality. The sense is that now is not a good time for legislation on this. The industry is moving really quickly, and any legislation would probably be outdated as soon as it was passed and unnecessarily restrictive. Although in the case of the Software Act and PROTECT Act, the opposite is probably true. There's a real danger, acknowledged even by those folks who would like for this process to move as quickly and easily through any administrative or regulatory barriers as possible, that complete deregulation is actually not best for the industry. Obviously, the government is devoted to protecting patients, and I think a lot of the companies that we talk with are also very focused on patient outcomes and patient safety, especially given the fact that a lot of the reimbursement is going to be quality based. But there's also a need to maintain credibility in the health IT system. This is still a lot of the health IT that's coming out now is pretty new, and deregulation has the potential to cause just a flood of ineffective products into the market, which might impede the success of the higher quality product, which again could damage the credibility of an uptake of this kind of technology, especially for consumers. So what we have to look forward to is the fluid process of guidance coming from the agencies. Hopefully, there will be guidance that provides more concrete information as requested during the comment period. It will be important to stay aware of the latest changes, but I would just reiterate that the underlying message is unlikely to change. The government has very little interest in trying to wrap its arms around all of this. It's going to be really looking at the risk to consumers and whether those risks are balanced with the potential benefits when deciding to focus its oversight attention. And right now, the desire is really to err on the side of taking a hands-off approach and trying to let the industry come up with best practices and standards and to sort of self-regulate. For those of you that are working now to design, implement, adopt this kind of health IT, I would consult an attorney, or I would get in touch with the FDA. There's also a HHS Science and Technology office that is very close to this effort, and so I wouldn't hesitate to reach out. And that's the close of our presentation for today. I've seen a couple questions I haven't gotten to, and I'll come back around to it. But I just wanted to give you the website again. These slides are going to be posted at www.healthcaresolutionsconnection.com. Healthcare Solutions Connection has a number of sort of niche experts in the healthcare industry. So while you're there checking out the video, go ahead and check out some of the experts we have in the network and sort of what their specialties are. You could also contact us at the number listed here, 202-827-1213, or you could email me or Carrie Nixon at the Nixon Law Group. It has been an absolute pleasure, and I'm going to go ahead and start looking at some of the questions now. So I've got a question about recording cough sounds, as recording is considered a standard function of a phone. So again, you have to look at the functionality in the context, in the broad context. So you'd have to look at the fact that the app is not just, I assume we're talking about an app, the app is not just recording cough sounds. What is it doing with them? If the purpose is to record sounds so that the device itself comes up with a diagnosis, then you're getting into sort of medical apps, FDA-regulated territory. If the purpose of the phone is to record the cough from the patient end, or the purpose of the app is to record the cough from the patient end, that sound file gets transferred to a physician, and the physician makes a determination. I think that's more that's less a medical, less likely to be regulated by FDA because there's a clinician intermediary. The second question. If we think our app might be subject to regulation, do we have to actively apply to ONC or FDA for certification, or do we just assume that we will be regulated? So I think the best case to do, the best path to take in that scenario is to contact FDA and see if you can speak with someone there about it. I would also recommend you contact an attorney that can sort of help you do the analysis based on the FDASIA report. But there is no, unless you're talking about a medical device, there is no application or certification process. If you fall into the category of health management, health IT, which is a really broad category, there are no new mandatory reporting or application processes required. This is all on a voluntary basis, and the ONC will be coordinating any activities. And further, the FDASIA Health IT report was just a report mandated by the FDASIA law and doesn't hold any legal authority. This is not even sub-regulatory guidance. There is no regulation that forms the backbone of this report. This is really about how ONC and FDA and FCC plan to look at health IT. I would not assume that the health IT is regulated, because what I've seen is there's a desire to keep as many things on the not regulated list as possible, unless they pose a threat to patient safety, in which case you got to get on the phone with FDA. So the last question is, when do you expect additional guidance to be issued? This year was supposed to be a big year for that. In addition, the Health IT Safety Center was supposed to open this year. I think given the response of folks in Congress, sort of disputing the authority of the ONC to move forward with the report, I think that's really going to slow things down. So, it could be later this year, it could be early next year. So, seeing no more questions, I just want to thank you again for joining us on the phone, and I hope you enjoyed the webinar, and please shoot us a note if you have any follow-on questions, and otherwise have a great afternoon. Thank you.